Good afternoon. We're speaking from Manila, Philippines. We welcome everyone to this one of the series of our webinars under the University of the Philippines, CFAL Philippines. CFAL Philippines, one of the 20 global centers which are affiliated with the United Nations Institute for Training and Research. What we do at the moment has been a series of discussions, sharing of ideas, discourses, but also looking for some ways forward on how to deal with COVID-19 pandemic. Welcome to this discussion on no crowding, please, COVID-19 and physical distancing. Today, we have a total of 1,582 registrants and still counting. So we welcome every one of you who come, mostly from the Philippines, but not only. We have registrants from the United States, from Oman, from Sri Lanka, from Bahrain, Sweden, and the United Kingdom. We also have participants coming from the Academe, the University of the Philippines, the I Academy, one of our partners, Batangas State University, Universidad de Zamboanga, Western Visayas State University, Technological University of the Philippines, Mapua, Miriam College, the Philippine Science High School. We also have registrants from national and local government agencies, mostly from the Department of Education and also from the Department of Science and Technology, my other home. We also have registrants from the private sector and non-government organizations. The Ramon Aboitiz Foundation, which is one of our other partner, the Food for Hunger, Ayala Foundation, and ABS-CBN Foundation, one of the most embattled media outfits today. Anyway, why did we call for this webinar? We know that at the heart of the pandemic are measures that encourage and convince people to observe so that we can defeat and overcome COVID-19. One of these measures is social distancing. But hang on, we don't want to call it social distancing because we want to be socially. We want to connect the economy to the rural economy. We will connect the rich and the poor, sharing and by each other. We want to connect everyone, government, civil society, citizens, communities, our local government, which is very much at the center of managing the pandemic. And therefore, we want to stay connected, but we want to observe the physical distancing called for measures by the United Nations and the WHO. According to one information source, physical distancing or distance itself accounts for around about 75 to 70 what we considered as a measure that keeps the virus away. And it is in this regard that for those who just would normally say, let's have social distancing, we want to look more closely and more intently into the issue of distancing. Why physical distancing? Can it be possible that we are distanced from each other, but we are still socially connected? In this afternoon's webinar, we'd like to look at distancing from various dimensions. From the technological dimension, from the human rights dimension and the citizens' rights, and also from one who manages and is on top of the pandemic management, which is government, and specifically the local government, where people are grounded, where people are based, and where communities are found. And therefore, as we discourse, we also want to emphasize and contribute to how we can find and propose strategies of balancing physical and social distancing better, how to implement distancing, considering technology, local governance, and human rights aspects in our midst. Today, I'd like to thank, first of all, our partners, our sponsors, our co-organizers of this forum, namely Academy. Welcome and thank you very much, Ms. Vanessa Tanco, for joining and collaborating with us. I also like to thank the Ramon Aboitiz Foundation and of course the Inquirer.net as our online media partner. On top of this, there are so many people who are tuned to us, who are listening, but we would have to manage the time. Therefore, we will have allocated talks given to Academy, our resource person from the Academy, and also from the Human Rights Watch, as well as from the mayor herself of Quezon City. I also like to mention that there are some house rules of this conversation. The participants are by default on mute. The question is for the resource persons. You can please use your Q&A box at the bottom side of your screen. You can ask questions, submit the questions for viewing by our experts, panelists, and then be directed by the panelists through the screen, or we may come to the oral conversation, the response towards the end of the forum. So everyone will be given a copy of the presentation of the panelists, and the recording will also be emailed to all our registrants. For this forum, we would like to also look at the topic of distancing related to the promotion of Sustainable Development Goal by the United Nations, specifically SDG 3. And SDG 3 pertains to good health and well-being. Physical distancing is required to slow the spread of COVID-19 and to keep us in a state of wellness and good health. Similarly, it is connected to SDG 17, which is a partnership for the goals. No one defeats COVID-19 and the pandemic without the collaboration and the cooperation of everyone. We should aim for a partnership of the common goal to defeat COVID-19. And this refers to collaboration among the public sector, the business sector, government, and all other stakeholders, including civil society. With this, I'd like to now hand over our floor to our first speaker, who will share with us leveraging technology during a pandemic, particularly MAZE, the country's first physical distancing app. Our expert is Ms. Vanessa Tanco. She holds a bachelor's degree in legal management from the Ateneo de Manila University, a master's degree in business administration from the University of Southern California. In 2007, she entered Academy as head of the marketing department. Since then, she has been at the forefront of expanding the college by offering new dynamic courses through design and steered Academy's partnership with Philippines, Wacom, IBM, Amazon Web Services, and PwC. Ms. Tanco is currently president and CEO of Academy, and she vows to make Academy the top technology and design school in Asia. Now, without further ado, let me now hand over the floor and the discussion and the time to Ms. Vanessa Tanco. Vanessa?
Thank you, Dr. Edna. Good afternoon, ladies and gentlemen. Academy is one of the most innovative educational institutions in the country today. We teach senior high school and college students specialized courses in the fields of computing, business and design, such as software engineering, game development and design, animation, multimedia arts, and many more. Our strength is that we are technology-driven and that we have very strong ties with the industry. Most of our faculty members are industry practitioners and they bring their knowledge in the field to our school. Our students work on projects that are very relevant to the needs of our community. So when the pandemic struck, we thought of ways on how we as an academic institution can help our government and our community cope with the crisis. First, we leveraged our strengths in education and technology and came up with a series of webinars on the new normal that explained how flexible remote learning would be delivered. We also came up with free online medical and guidance counseling for our community with the help of our doctors, our nurses, and our guidance counselors. Then we partnered with our industry partners to offer part-time jobs to our students, knowing that some of the families might be going through hard times. But we knew that we could do more for the larger community. So we came up with MAZE. MAZE is our response to COVID-19. It is the first physical distancing app created in the Philippines. Through MAZE, we were able to share our school's expertise in both technology and innovation. Physical distancing is one of the ways to prevent the spread of COVID-19. But we noticed that there are a lot of reports of people flocking certain areas despite the rising number of COVID-19 cases. We came up with this app because we want people to make informed decisions before going out to run their errands in potentially crowded places, such as public markets, grocery stores, pharmacies, banks, and other essential places. MAZE was built to help flatten the curve, but this app is something we see useful even after COVID-19, much like how those traffic apps work, but this also helps those on foot as well. Can the slide be moved to the next slide? Next slide. Next slide, please. Next. One more. Okay, so this app is free. You can access it via website or download it on the Google Play Store for Android. The web address is maze-academy.ph. We are still working on the iOS version. Next slide, please. With MAZE, one of the biggest challenges for us, can I have the next slide? One of the biggest challenges for us was to get the word out and to get people to start using the app. We tried to partner with the Department of Health, but they already had an existing partnership with another app. So we decided to partner with the Department of Tourism to help us roll out the app. We picked the Department of Tourism because iAcademy already had an existing partnership with them. We previously designed an app in partnership with DOT called Experience Philippines, which makes use of augmented reality or AR tech. This was an app wherein tourists and other local culture buffs can experience and relive how Intramuros looked like in the past just by clicking a button in their mobile phones. So we partnered once again with DOT to help us disseminate information regarding this app. And we would really like to thank Sec Berna for her support for this. And we are glad to work together once again with the Department of Tourism on this project because we know that it will help us rise above the pandemic together. Yeah, next slide, please. So there were a few developers, and there are still a few developers that develop different apps like contact tracing apps to help fight COVID-19. And we actually thought of doing something similar to that at first, but there are a lot of technicalities and validation required. So we decided to make it a bit simpler. We wanted an app that people can use on a daily basis, and even after the pandemic is over. And we are proud to share that unlike other apps, we require very little information from our users, which makes it less tricky, more user-friendly, and more conducive to use. Next slide. So once you log on, this is what you see. It shows you an immediate density report within your 50-meter radius. Next slide. But you may also search for a particular location and check the density there too. So you can type in like grocery in Makati, and then they will show you the different groceries that are in the app. So you can just choose a place that you want to go to. And this is really something that aims to help people make an informed choice about their errand with or without the pandemic. The timing of this app is just more appropriate given our current health crisis. Users, next slide. Users can view and report the density in their area. Now, this is where we hope that people will use the app responsibly. The more people report and send in accurate data, the more people this app can help. So it banks on the bayanihan spirit of the Filipinos. We are also looking at a more developing and expanding the use of this app. We've spoken to doctors who said that especially now at the height of COVID-19, it would be very good to have an app that can also show patients the room availability in hospitals, so that if one hospital is already full, the patient can choose to go to another hospital with vacancy. Next slide. Users may also share photos of their reports. We also included a feature where users can report a photo if it is malicious or if it is not related to the location, like random pictures from the internet, or if the picture of the place is wrong. So users can email us at maze@iacademy.edu.ph for concerns or suggestions. So next slide. So this app, through this app, we hope that we can keep people safer and healthier. Thank you.
Thank you very much, Vanessa, for that brief but very straightforward presentation on the Maze app as a medium or a platform by which people can maintain distancing but continue to be connected and to be informed regarding whatever they want to do or they plan to do. So please take note for those of us who are in the audience who are participating. You can start to put your questions on the Q&A box below your screen at the bottom at the bottom of the screen, and we will try to hold on to the questions until after all three experts have spoken. In the meantime, I'd like to give the next expert to speak to us. He is a researcher from the Asia Division of the Human Rights Watch. I'm referring to Mr. Carlos Conde, who is a Philippine researcher for Human Rights Watch Asia. Before joining Human Rights Watch, he has worked as a journalist for 20 years, nearly half of the time as a freelance correspondent in Manila for the New York Times and the International Herald Tribune. Prior to that, he worked as a reporter and editor for various publications in the Philippines. He's worked much of it about politics, human rights, and so on, including labor migration, has appeared in several publications in the Philippines and overseas. Mr. Conde has been a fellow at the Philippine Center for Investigative Journalism and the Center for Media Freedom and Responsibility. And you are right, he will speak very strongly on the human rights. He was also a Jefferson Fellow at the East-West Center of the University of Hawaii, where he tackled issues on peace, conflict, and terrorism Ladies and gentlemen, let's please welcome Mr. Carlos Conde. You may now have the floor.
Ma'am Edna, and thank you to CFAL for having me here this afternoon to talk about the human rights context of the COVID-19 pandemic. I'd like to begin by outlining the human rights concerns surrounding COVID-19. International human rights law guarantees everyone the right to the highest attainable standard of health and obligates governments to take steps to prevent threats to public health and to provide medical care to those who need it. Human rights law also recognizes that in the context of serious public health threats and public emergencies threatening the life of the nation, restrictions on some rights can be justified when they have legal basis, are strictly necessary, based on scientific evidence, and neither arbitrary nor discriminatory in application, of limited duration, respectful of human dignity, subject to review, and proportionate to achieve the objective. The scale and severity of the COVID-19 pandemic clearly rises to the level of a public health threat that could justify restrictions on certain rights, such as those that result from the imposition of quarantine or isolation, limiting freedom of movement. At the same time, careful attention to human rights such as non-discrimination and human rights principles such as transparency and respect for human dignity can foster an effective response amid the turmoil and disruption that inevitably results in times of crisis and limit the harms that can come from the imposition of overly broad measures that do not meet the above criteria. Under the International Covenant on Economic, Social, and Cultural Rights, which most countries have adopted, everyone has the right to the highest attainable standard of physical and mental health. Governments are obligated to take effective steps for the prevention, treatment, and control of epidemic, endemic, occupational, and other diseases. The Syracuse Principles, which was adopted by the UN Economic and Social Council in 1984, and the UN Human Rights Committee General Comments on States of Emergency and Freedom of Movement, provide authoritative guidance on government responses that restrict human rights for reasons of public health or national emergency. Any measures taken to protect the population that limit people's rights and freedom must be lawful, necessary, and proportionate. States of emergency need to be limited in duration, and any curtailment of rights needs to take into consideration the disproportionate impact on specific populations or marginalized groups. So those are the main human rights concerns by Human Rights Watch, in the context of the pandemic. In the Philippine context, I would like to point out some of these issues. We have to keep in mind that in the Philippines, the COVID-19 pandemic has been unprecedented in scope and on so many other levels. So the public and the government was actually forced to make do with what they have. This is not to say that the government was wholesale unprepared, but we saw from the very beginning that the response was basically making do with what they have. And one of these key enforcers of the lockdown and social distancing measures are the barangays. Because to be honest, there's no one else that can do the job. Unfortunately, the barangays are not well equipped to handle the public health crisis either. They are as flummoxed by the pandemic as everyone else. This may explain the initial conduct that are clearly abusive on the part of some, not all, but some barangays during the onset of the lockdown. Cases like putting violators in dog cages, arresting and humiliating members of the LGBT, making them perform in public, asking them to kiss in public as punishment, and punishing them by exposing curfew violators to the sun for hours. Many are jailed without any social distancing because the jails are packed. Barangays and local police really have nowhere else to put the people they arrested for curfew violations. So they are forced to pack them in detention centers and often in multi-purpose halls or basketball courts where they are exposed to the sun and the elements for hours as a form of punishment. Barangays, more importantly, are forced to follow the orders of the national government, for example, the Department of Interior. So the tendency to use strong arm tactic was apparent from the very beginning. Then there's the matter of jail congestion, which was a problem. And it was clear from the very start that the BJMP, the Bureau of Jail Management and Penology, and the Bureau of Corrections, as well as lockup cells run by the police in various precincts around the country, were not ready to handle the pandemic and the impact and the subsequent effect of the pandemic on the population. The release of prisoners only happened after the ECQ was lifted, although the Supreme Court had already announced that it had authorized the courts to release eligible detainees, such as those who were minor offenders and the elderly. Detainees in several BJMP-run prisons have complained to us about the situation inside the detention facilities where social distancing was practically impossible. And we saw this in pictures that were circulated afterwards. On the part of the police, the conduct of the police are equally abusive in many instances, particularly in the context of protest and subsequent arrest, where social distancing was the first to be disregarded. Several instances of police arresting violators and detaining them with no thought for social distancing. The latest was the case of the 20 Pride March protesters who were arrested last week, and also the nearly 100 people who were arrested because they were allegedly drinking in a Makati bar. And as far as we can tell from the media coverage, there's not a lot of social distancing that was followed, not just by those who were arrested, but even by the arresting officers. According to the CHR, 107 complaints against the police have been filed for torture, arrests during lockdown, and 55 complaints of extrajudicial killings. In some cases, many of the police officers who were operating were not wearing masks. Then there's the issue, of course, of police and authorities themselves who are not following lockdown regulations, such as those not wearing masks and not social distancing. This severely undermines the credibility of the government. Then there's a matter of the stranded individuals that are now all over Metro Manila and in urban areas. According to reports, there are nearly 130,000 of them who are stranded, and their plight only came to light after pictures were published of them cramped in terminals and in the pier in the North Harbor. I mean, clearly, poverty is a very big issue in the Philippines as far as COVID-19 is concerned, and this poverty severely hampers the efforts of the government to keep social distancing, and also, needless to say, also hampers the ability of residents to keep social distancing. I mean, we've seen the pictures of families cramped in their barong-barong, these hovels made of tin walls and tin roofs. And during the summer, practically they were detained in these hot houses during the summer, and that is obviously a very, very, very big problem, and that severely affected their welfare and their health, including the children, especially those who are vulnerable. The ones with special needs are also very, very vulnerable. Finally, I would like to enumerate here some human rights concerns that Human Rights Watch has put forth. Number one is government should protect freedom of expression and ensure access to critical information. Number two, it should ensure that during quarantines and lockdowns and travel bans, that these are compliant with human rights norms. The government should protect people in custody and in institutions. It should ensure the protection of health workers. It should fulfill the right to education even if schools are temporarily closed. It should root out discrimination and stigma, protect patient confidentiality, ensure the marginalized population can access healthcare without discrimination, protect community and civil society organizations, promote the rights to water and sanitation, ensure economic aid continues, and to target for economic relief those who are low-wage workers. I mean, these are much more, these concerns are obviously quite expansive, but in our view, this could help in making sure that people are observing the measures that they need to keep during the pandemic, such as social distancing. Thank you very much, and good afternoon.
Thank you very much, Mr. Carlos Conde, for that presentation. If I may say this, the panelists are please invited to look at the Q&A box because there's already loads and loads of questions that are addressed to the panelists. And if you can answer some of them, because I'm afraid we may not be able to take up all the questions orally on right here on the screen, so you can probably start to look at them. But before anything, does Abby want to share an Inquirer.net short of a short second break before we proceed to our third expert speaker? If not,
Got something you want to share to the world? We got you, fam. We are looking for awesome people like you who want to share content that deserve a spotlight on our site. Whether it's a list of everything you love about catos and doggos, pop culture related artworks, or even your own random photos, memes, and funny videos, we'd be happy to see it and share it to the world. Join our award-winning team and be part of our Ink Pop creator community.
Hey, it's me, Guyito. Want to become a writer, artist, or photographer when you grow up? Test your creative skills with us. We're looking for kids aged 7 to 12 years old with unpublished work like articles, short stories, poems, essays, artworks, videos, and others. Join our award-winning team and be a part of our Kinderpop contributors and get your awesome work published for the entire world to see. Send in your work to pop@inquirer.net or visit facebook.com/inkpop to know more. Now let's show them how kids get it done.
all right, thank you very much for that. We are looking forward to our third speaker for today. She's special to us because the Quezon City Chief Executive, the local Chief Executive, is a member of the UP-CIFAL Philippines Board. And in that sense, we are honored, doubly honored to have our next speaker with us. But not only that, in her own capacity and in her position and role as the mayor of Quezon City, the biggest city in Metro Manila, the speaker here will talk about the not just the app. It's not our observation on what happens to people's rights under the COVID pandemic, but here are some probably very engage discussions that she can offer to us and can share with us rather on the challenges, the difficulties in implementing physical distancing in Quezon City. So I'm speaking of someone, who else but our own mayor of Quezon City, elected mayor of Quezon City in 2019. Recently, she was chosen as one of the top 10 outstanding mayors of the Philippines by the Gawad Filipino Awards. And prior to this, she served as the vice mayor of Quezon City. In her 9 years as public servant, she was awarded with various recognitions from international and local organizations, such as the most outstanding vice mayor by the Gawad Sulu ng Bayan, one of People Asia's women of style and substance, and the Mother's Heart Heritage Award as outstanding woman in local legislation and service to women and children by the Women's Federation for World Peace, among many others. We're just saying here, Honorable Mayor, that you're a woman not only of style, but also of substance, but also of style. And I think these two need to come together. At present, the Quezon City government received already various awards, such as the Seal of Good Local Governance from the Department of Interior and Local Government, first place in overall competitiveness, and the first Hall of Fame awards from the Department of Trade and Industry, among others. Aside from being Chief Executive of Quezon City, which is not so easy to do, she is currently the Executive Vice President of the League of Cities of the Philippines and a member of, as I said, the UPCPAL Philippines Board of Representatives. May I now give to you our dear Mayor of Quezon City, Maria Josefina, or simply Mayor Joy Belmonte. Welcome, Mayor, and thank you for sharing your afternoon with us.
Thank you, Dr. Edna, and thank you to all of the people who are taking time out to listen to us today. Thank you to Vanessa for her wonderful talk, and thank you also to Mr. Conde for that very enlightening talk on human rights, which was very helpful and is very helpful to us here in Quezon City. So as told to me, the topic of my discussion today is COVID-19 and physical distancing as a local governance issue. I will talk about briefly the different things that we are doing here in Quezon City to ensure physical distancing, and then I will talk about the challenges that we are currently facing, and then some recommendations that we can probably apply to further improve on our efforts. Next slide, please. So I know that there are many listening right now who are not from Quezon City, and for all of you, I just want to share a little bit about what my city or our city is. So it is the largest city in the National Capital Region. It is also the most populated city in the Philippines with about 3.1 million people. I'd like to stress that during the lockdown period, we had about 4 million people because there are many people working in Quezon City who were stranded here during the lockdown, who also became our responsibility in terms of providing for food and shelter. Of course, we have the male and female ratio is about the same. And I also would like to add that the mean age here is 24 years old. So we are a very young city with a very young population. Next slide, please. So just to give you a little bit of a background about our COVID situation, many people tend to say that Quezon City is the epicenter for COVID, which is not quite true, and I'll tell you why later. But in terms of absolute numbers, Quezon City is second right now to another local government unit. In terms of DOH confirmed cases, as of yesterday, July 2, we had 3,515. And in terms of the cases that we have validated as a local government unit, there are 3,407. And people tend to ask me why the numbers are different. And it's because a lot of the people who are tested sometimes don't put their complete addresses, or else they put addresses of houses that actually don't exist here in Quezon City. So there's always a discrepancy between the DOH cases and the city validated cases. Now, I'm happy to say that in terms of recoveries, we have 2,003 recoveries as of today, and active cases about 1,169. So before we proceed, I'd like to show you this map. So it's now on your screens. And just for the information of everyone, the yellow color symbolizes moderate risk areas. What is moderate risk areas? These are areas with 9 cases or below active cases. The red areas are the high risk areas with 10 and above. And the blue areas are the low risk areas. They have no cases, but because they are adjacent to areas with COVID positive areas, they are considered low risk. No? So that's the current configuration of our city. Next slide, please. So if you notice, the rate of increase per week since May 1 has actually gone down. It was 13% in May 1, and since then, it's been going down, albeit very erratically. So sometimes it's 9%, sometimes it's 11%, sometimes it's 10%. We've gone down as low as 7%, and now it's, well, as of June 19, it was 10% again. The line graph adjacent to that chart will show you a kind of a crooked line, and that kind of tells us a little bit about the patterns here in Quezon City. It's not quite going up, but it's not quite going down yet. It's kind of like on cruise control. And the reason is that, well, we tend to test a lot more now, but we also have a lot more recoveries now. So when we have new cases, we have about the equal number of recovered cases. So it kind of offsets the new cases. No? So that's why our line is kind of steady. But of course, the goal is to lower that line, decrease the numbers considerably. And that's what we're trying to do at present. No? Next, please. But just to put everything in perspective, earlier I said that it is not true that Quezon City is the epicenter, and this chart to my left will show you that actually of all of the local governments in the Philippines, Quezon City is only the 13th in terms of incidences per 1 million. So that's how doctors tend to measure the impact of a disease, incidences per 100,000 or incidences per million. And in the Philippines, Quezon City is only number 13, although that's still pretty high. And in the NCR region, Quezon City is number 9. Again, I'd like to reiterate the NCR bar graph to the left of this colored graph to the bottom of your screen. It shows that Quezon City's recovered patients is higher than the NCR average. This is as of June 27, but I know that as of July 1, we already reached 60% in terms of the number of recovered cases. And our active cases is 33% and our deaths is 7%. And that's higher than the NCR average, unfortunately. No? So next slide, please. So again, what is the basis for physical distancing or enforcing physical distancing at the local government level? There are several. Of course, we are familiar with the it's actually IATF Omnibus Guidelines on the implementation of community quarantine in the Philippines that was issued on May 22, 2020. But we also know that every member of the IATF, the DOT, the DTI, the DILG, the DOH, etc., they have issued their own separate guidelines pertaining to GCQ or community quarantine. And the Quezon City government as well has issued its own localized guidelines for the GCQ period. And we've since also issued guidelines for every sector. No? So apart from the general guidelines, we have guidelines for the transport sector, for the market sector, for the mall or retail sector, for the education sector, etc. And that's just because we want to make sure that the people are guided and there are no gray areas in terms of what they should be doing, because usually the IATF guidelines tend to need more detail to them. And that's what we've been doing to make sure that our people are well informed here in Quezon City. Next, please. So just to remind everyone, what are the general principles of the GCQ? So number 1 are the minimum health standards must be complied with at all times. And of course, physical distancing is first among them. Mask wearing, the use of thermal scanners, good hygiene practices, etc. Now, we are all familiar with these health standards. Movement of all persons is limited to accessing essential goods and services only. And work for industries permitted to operate. That is true until now, no, because now there tends to be a lot of confusion. People think that they can do leisure activities now, or they can do other things not related to the essential good or essential activities. But I just like to remind everyone that it's still essential goods and services that must prevail at this time. Limited mall operations. Then, of course, face-to-face classes are suspended. Mass gatherings are limited to 10 persons or below. Limited outdoor activities only. Although today I heard that there is a new directive from the IATF that more outdoor activities have been allowed, like basketball and soccer, I think, or team sports. And that will be a little bit of a problem for us here in Quezon City, actually, as I will explain later. Strict quarantine of high-risk persons, and these are pregnant women, persons 21 years old and below, and senior citizens, especially those with comorbidities. And of course, limited public transportation. And as of yesterday, the GPs were allowed to ply their routes, but only a few of them, not all of them, were allowed to go out. And some buses are still not yet operational. Next, please. So why physical distancing? It's very clear in the picture to the left. The math behind social distancing. So if there is no social distancing, by day 30, we would have already infected 406 individuals. With social distancing, we would only have infected 2.5 individuals if assuming we were positive for COVID-19. No? And this is the advisory that we hold on to. It's the DOH advisory telling us that we should at least have a gap of 1 meter between ourselves and the person next to us. But this has now been increased to 2 meters or 6 feet. Is ideal, and then we've been having problems. Of course, obviously, enforcing this 6 feet directive of the DOH. Next, please. So in City Hall or in the workplace in general, these are some of the things that all of us, who have offices are doing. We have been making sure that our furniture is arranged in such a way that people do not sit too close to one another. So the red seats, those are the seats that are in our treasurer's office when you're paying your real property taxes physically. You cannot sit next to a person in the seat next to you. No? So there's an X. And then this is the lounge where the executive department heads meet. Well, this is every Wednesday for our Execom. Actually, that's not really where we meet. That's where we entertain dignitaries when they come to City Hall. But because our boardroom has now become too small for all of us, we've had to move to that area up in City Hall. And so we've physically distanced the furniture to make sure that we don't contaminate one another should we be ill. Because as you know, most of us in City Hall have never taken a break. Most of us have been frontliners. I myself have never skipped a day of work since the first day of ECQ in March 15. Next, please. So in the workplace, again, in City Hall and other workplaces, everyone is encouraged to put floor markings, signages, barriers to remind people to physically distance, especially in transit points. So what are transit points? These are elevators, escalators, restrooms, and other areas where people tend to converge. So here we have signages, we have markers. This is the middle photo shows the queue going to the elevators in City Hall, and every floor has these signages. And almost every area has them, as well as alcohol and other disinfecting equipment or facilities. Next, please. So here we have physical distancing again in the areas where there are people who have to transact business in City Hall. So we have, I don't know if it's clear to the viewers, but there are actually acetates or plastic in front of or in between the customer and the frontliner to protect both from each other's potential infections. Now, next, please. So again, physical distancing, we need marshals to be deployed to manage personal movement, because as you know, our culture is not really all that friendly towards physical distancing. We like to kiss each other, we like to make beso, we like to hug each other. It's been very, very difficult actually to enforce physical distancing. So we've had to get the help of marshals, and in this case, sometimes the Philippine National Police or the Quezon City Police district officers, and we have our own Department of Public Order and Safety. And every time there is a convergence of people, they are present to make sure that physical distancing is observed. So again, in the workplace, like what we are doing now, a Zoom meeting, it has been customary for us to either, for at least for the employees, to work from home, especially those in the vulnerable sector. So right now I have a directive that if you're 60 years old and above and your work is not indispensable, or it is not absolutely necessary for you to be physically present in City Hall, you can and should work from home. We do telecommuting, we do virtual meetings, even within the City Hall premises. We don't meet with one another in person. We still use Zoom and other similar devices or applications, and we try to practice compressed work weeks here as well. Next slide, please. So again, we are trying our best to fast track the no contact engagements in City Hall. It has been one of my campaign promises to make sure that after a week in public office, most, if not all, transactions should be online. And we've had to fast track this given the new normal. So now you can actually pay your taxes online. If you would like to pay your real property taxes, you can do so, your business taxes as well. If you need legal assistance, there is, we have e-legal services available for everyone who needs to download, let's say, certain types of documents, especially those that are already of a certain template. You can just download them. If you need legal assistance, our lawyers are online. They can answer your queries, etc. So I think that's one of the latest and more unique features that we have been able to offer the people. And again, with regards to applying for any kind of permit or license, like your business permit, if you would like to renew it, if you would like to apply for a new one, building permits, and all kinds of permits, most of these can be done online already, requiring only one, if any, personal appearance in City Hall. Next, please. Even with regards to social services delivery, we've also managed to try our best to do this online. So we have a program in Quezon City called Kaligang QC program. And in the beginning, we were giving out our payouts or our financial assistance to our vulnerable sectors personally. And we're still doing that at the moment for those who are having problems or having difficulty with GCash. No, but those that have that capability, we are already downloading their financial assistance through GCash. We also have e-services now available, helping PWDs and senior citizens apply for their IDs online as well. No? So I think that's also something that will be very helpful, especially as last week there was some kind of a like a scandal or a controversy pertaining to people who tend to abuse their PWD cards because there are a lot of fixers in government offices. Now, I've tried my best to make sure that fixers are actually arrested and we file charges against them because I do not tolerate bad governance. I'd like to try to pursue good governance in Quezon City, but I think there have been many cases of fixers having given out PWD cards and senior citizen ID cards in the past. And while we're cleaning up the system, we are implementing these services online now. Next, please. So again, like I mentioned, physical distancing in the transport sector. Earlier on, buses were not allowed in the GCQ. So we've had a program called Libreng Sakay, where we entered into agreements with bus companies and the city government provided these buses free of charge for the commuters in Quezon City. The city government paid for the gasoline and the salaries of the drivers, and the bus companies provided the buses. And we've practiced social distancing there. Every time a passenger goes up into the bus, someone would take their temperature and would assign a seat to this passenger. Yesterday, the jeepneys were allowed to start plying their routes. And here you have an example of a jeepney where we've been able to put plastic in between passengers. No, our tricycles as well have been allowed to go on the streets, and one passenger only per tricycle is the rule. And there is also a plastic barrier between the driver and the passenger, and no back riding policy is strictly implemented in the transport sector. Next, please. So in the markets, this has been very, very challenging because, as you know, markets have always been allowed to operate because this is a source of food. This is an essential service. But we've been very, very fortunate in that we've been able to been quite successful in implementing social distancing and physical distancing there as well. So you see an example of the market vendors themselves taking the initiative. They put plastics as well between stalls. And we also have enforcers in every market. They're called Market Development and Administrative Department officers or MDAD officers, and they're down on the ground to make sure that the people follow physical distancing measures. We only allow a certain number of people into our markets now. You know, we count how many are inside, and then people wait outside until somebody comes out. So we're quite disciplined now in our marketplaces. And we also have taken measures to protect our market vendors. Just recently, we found out a lot of market vendors have been testing positive for COVID, and so the city has been distributing face shields and face masks very aggressively to all of the market vendors to make sure that they are protected at all times. No, next, please. So in the restaurants as well, they started operating, and we've been very, very stringent with regards to making sure that they follow physical distancing measures. So they always say a restaurant now in Quezon City looks like a classroom because everyone just faces in one direction. And then in one table, there's only one person or two people at most. If the table is larger, we encourage people to reserve before they go to any restaurant so their food is already ready when they come into the restaurant. We don't want them to loiter. It is not a place for them to do leisure activities or to meet up with friends. It's just a place for them to eat. No, that's the rule that we want to perpetuate now. No, and we also encourage all of the wait staff to wear face shields and face masks. We do contact tracing very aggressively in Quezon City. So if you go into a restaurant and you're asked to fill up a form, please don't get angry, because this is supposed to help us in case somebody in that restaurant tests positive. We can protect you as well and make sure you were not one of those that were infected. No, so there are many measures. I've issued maybe 5 pages of guidelines just for our restaurants to make sure that social distancing and protecting our health standards are in place, because of course we're serving food, and we want to make sure as well that sanitation is properly observed in our restaurants. Next, please. And I think I might be going over time. I have to talk faster. So in terms of schools, Mr. Conde earlier said that every child has the right to an education, and I believe that as well. And here in Quezon City, we have passed a budget of 2.9 billion pesos to make sure that every child will be educated properly, even if they are not attending school physically. So high school students will be given the use of tablets, and elementary students will be given modules and flash drives, and their teachers will be given the use of laptops. All schools will be connected. Tablets will be bundled with internet as well, so that the high school students will have access to the internet. And I think that we've left nothing uncovered here. We've done everything that we can to make sure that education is not sacrificed in the next school year. Next, please. So challenges in implementing social distancing, there are quite a lot. Next, please. I already mentioned earlier. So one is enforcement. How do you make sure that people physically distance? How do you make sure that the guidelines are truly being followed? How do you make sure that everything that is issued in terms of advisories by all the different agencies are being respected and being enforced or implemented? No? So we have a hotline. It's called Dial 122. That's only one way in which the general public can help us. If they see people violating social distancing or physical distancing protocols, they can just dial 122, tell us where this location is, and the nearest possible enforcer will come forward and will try to put order into these places. No, you can also reach us through social media, and actually we have various other hotlines available per department that you can actually call and reach if you would like to just talk about one specific area, like restaurants or markets or transportation, etc. No? So we have that in place, and we really encourage the general public to participate and help us by informing us about these violations. We have installed, can you go back? Yes. So previous slide, please. We have installed a lot of new CCTV cameras that help us, especially in our marketplaces or places, again, where people tend to converge. So even from our offices, we can monitor whether there is physical distancing taking place in usually crowded areas. Here, we also have spot checking teams and surveillance teams. Spot checking teams visit our different restaurants and retail establishments to make sure that these are following our protocols, and surveillance teams are the teams on the ground to make sure that amongst people like commuters or pedestrians, they are following different protocols for social distancing. Next, please. So in terms of social amelioration, I think the biggest challenge was actually here. You are familiar with the social amelioration program of the DPWH, I'm sure, and one of I'm sorry, not the DSWD. DSWD. So they were giving 8,000 assistance to the poorest of the poor. But the problem was that the deadline that they gave to the smallest local government units with maybe 5,000 people was exactly the same period of time that they gave cities like Quezon City. So we have had to give 377,000 SAP payouts, no, of 8,000 pesos each. And let's say the smallest LGU at the same period of time had to give maybe what, 2,000, 1,000, etc. And that was a little bit of a problem, because how can you now maintain social and physical distancing when you have to pay out in person? These people, the poorest of the poor, of course, have difficulty accessing online resources. So they had to receive their assistance personally, and that was a very big problem. And if you noticed, a few months ago, we were really on the news because of the media bashing us for not being able to maintain social distancing. But really, it's because I begged and I really asked our officials from the DSWD, please give us additional time. We have much more people to serve here in Quezon City, but my pleas fell on deaf ears. So I apologize for that. It was not intentional for us to not respect protocols, but it was just, you know, a matter of just sacrificing one for the other, I guess. No. Next is, of course, the house-to-house distribution of food. That was also a challenge. Quezon City had to give out a total of about 4.1 million food packs throughout our city. We did not have any exceptions to this rule. Everybody was in need. The poorest of the poor, even those living in the richest of subdivisions, received food packs from the city government. And of course, like I said earlier, we also had to provide food assistance to the stranded people, not from Quezon City, but who were working in Quezon City and could not go back to their place of residence. Next, please. So this is a very nice example, though, that I'd like to point out. Quezon City is known as the bastion of freedom, the bastion of free speech, and I always wanted it to remain as such. And recently, there was a rally that was held in the University of the Philippines. Of course, you're familiar with that particular rally, and many people were very afraid that social and physical distancing would not be respected there. But as you can see, look at the people. They're so far apart. They were able to express their opinions, they express their feelings and sentiments while maintaining the protocols of physical distancing. And that's, I think, a wonderful example. This is a bad example I'm going to show you now. This is something also that was very famous not too long ago, and I'm sure Mr. Conde knows about this. This is an issue of a man in one of our barangays who was not wearing a mask. Our enforcers went to him, asked him to wear a mask. He did not want to wear a mask, so the enforcers used a stick and inflicted, some form of violence towards him. We, of course, in Quezon City, I personally do not tolerate violence of any kind. And this man, of course, this enforcer was dismissed, and this man was given some assistance because of what he had gone through. No. Next, please. So again, as mentioned by Mr. Conde, this is a very big challenge for us. This is enforcing physical distancing in our depressed and urban poor areas where the density of people is just tremendous. No? So it's almost impossible to enforce physical distancing in these areas. So what we always say is that if you cannot physical distance, at least wear a mask, because we do know based on data that wearing masks will reduce the risk of transmission by as much as or even more than 60%. Next, please. So again, another challenge is overcoming all of these cultural practices, like I mentioned, that we seem to have difficulty forgetting to set aside for the time being. So at our barangays have still reported to be parties, birthday parties with karaoke, boodle fights where people share their food from a banana leaf, very dangerous, social drinking or tagay-tagay where everybody shares one glass, basketball games where, of course, there's a lot of physical contact and a lot of breathing in of somebody else's oxygen or carbon dioxide, and then other contact sports as well. No, so these have been very difficult to control in the barangay level, as Mr. Conde earlier pointed out. And in the next slide here, or later on, I will explain what we are doing to address that. No, but here are some recommendations for better implementation. So just yesterday, I had a meeting with our 142 barangay captains precisely to discuss how we can address what I mentioned again earlier, which are the various cultural practices that we can't seem to overcome, as well as to make sure that there is some form of physical distancing taking place in our highly congested barangays. Now, so I met with them, and it turns out that a lot of it can be solved solved if there was just better coordination between, of course, the Quezon City Police District, our barangays, and our local government officials in City Hall. So we laid down some protocols that we could address together and enforce to make sure that physical distancing can be better implemented. Next, please. So another set of recommendations is, again, what we've been doing here in Quezon City, and we've been doing it very successfully. It's testing, tracing, and quarantining. So we have ramped up our testing. We test about 700 a day now in our communities. This is not including those who test themselves privately or who use rapid tests. These are PCR tests done in the communities. And then we do a lot of tracing. We have 300 contact tracers now, and we have about 30 teams that are simultaneously going into our communities doing contact tracing. And of course, we are the first LGU to establish a quarantine facility. Now we have 3 quarantine facilities with about 450 beds. And I think one sign they say that your city is still okay is if your healthcare system is not overburdened or not overwhelmed. And here in Quezon City, our hospitals are only 60% occupied, and our quarantine facilities are only about 70% occupied. So that means there's still some room for us to move here in Quezon City. Next, please. So something that is unique to Quezon City, but I think that other LGUs have now started to copy, is something called the 14-day special concern lockdown. And this is, again, connected to what I said about the density of populations in our urban poor areas. So there tends to be a lot of community transmission in these areas, especially if coupled with these cultural practices also that often takes place at that level. No? So the drinking, the basketball playing, the tagay-tagay, plus the congestion, that really is a recipe for a nightmare. No? And what we've done is, when we see even just a small cluster of community transmission, we already locked down this area. And I'm not talking about barangays. I can talk about, these lockdown areas can be a street, it can be a compound, it can be a sitio, it can be just a small area with as little as 20, 30 families, to an area probably as big as Kaingin Bukid in Apollonia Samson, which has about 1,500 people, but never more than that. No? And when we lock down a community, they are for 14 days, because that is what medical experts say is the time necessary for the virus to live out its course. So they are not 1-day lockdowns, 2-day or 3-day. They are really 14-day lockdowns. And while they are locked down, the communities, we test everybody in these communities. They are tested 100%, so that all of those that are positive can immediately be isolated. Or if it's the entire community that's locked down, then we make sure that they live out the course of their sickness in that community and are not able to go out of that community at all. No? So a challenge is, of course, making sure everybody stays in the community for 14 days, and that is quite difficult. That's why the Quezon City Police District works with us to make sure that there is security. Mr. Conde doesn't have to worry, because the police are instructed to exercise maximum tolerance here in Quezon City. I don't think that, apart from the few instances I've described, that we have been really in violation of these protocols. No? And of course, the city is the one that provides all of the food supplies of every lockdown area. So we make sure that they have food good for 14 or more days. And not just food, but all the necessities that they will need, so that they have no more reason to leave their communities for that 14 days. And we're lucky. And we're happy and to report to everyone that we started with 13 lockdown areas. Now we're down to 6, and hopefully it stays that way for forever. So next, please. And I think this is the last. So again, what are some other recommendations we are doing? Like I said, I don't like violence. I don't like what Mr. Conde has been saying, people are put in small prison cells, thereby risking their health, or cramping them up, or making them do things that are against human dignity. So what we prefer to do is do information and education campaigns in the community. So we have recently launched one. It's called Why I Wear a Mask, and this is on social media. It's also going to be put up in all of our billboards and all of the barangays, health centers, and all of the public buildings in Quezon City. No, it varies, of course. Now, there's many different models there. It's not just that one guy. And then in the very grassroots, we are doing very intensive information dissemination with regards to ano ba dapat ang bawal or what is prohibited. Because I think what happened was there was a lot of confusion from the transition from ECQ to MECQ to GCQ, and then there's MGCQ, and then there's the new normal. So people in the grassroots tend to be very confused about what is allowed and not allowed. And while I do not want to blame them for continuing the cultural practices that they do, because I think that it's part of the lack of information dissemination. And that's why we're doing that now very aggressively. So that here, for those who do not speak English, chismisan is gossiping. So we prohibit gossiping because gossiping tends to make you want to take off your mask and loiter around, and you're not really supposed to loiter around. No? We prohibit team sports like basketball, and you know that every community in the Philippines has a basketball court. It is the national pastime, but at the moment, you're sorry, but you're not allowed to play basketball. You're not allowed as well to make tambay, that means to loiter needlessly. No, inuman or drink in public places, and even if you're drinking in your home, which is a private place, but there are more than 10 people assembled there, not wearing masks and causing a ruckus, we are allowed to disturb your peace in a peaceful way, of course. No, and mass gatherings in the communities are strictly prohibited until now. So next slide, please. So thank you, and thank you for listening, and I'm happy to take any questions.
Thank you very much, Mayor Joy Belmonte. I think the first question to the good mayor is, does she still sleep? I think that's one immediate question one could raise after listening to this very extensive sharing. And well, there are some questions which are posted on the Q&A board. On the Q&A box, but I will begin with some of the questions. Some questions are actually answered by the mayor as she was trying to present and explain how things are going on in Quezon City. But one very interesting question is, what is the biggest challenge you encountered in Quezon City in dealing with COVID-19 and physical distancing, and what do you consider as a victory, as something you can be proud of, and something to share with other local government units, Mayor?
Well, I think that one thing that was very challenging, actually everything I mentioned earlier, Ma'am Edna, were all very challenging and all very difficult. And I think probably the most difficult for me was the distribution of the DSWD assistance, because that was not under our terms. That was dictated upon us by the national government. And of course, we had to follow the deadlines that they set, the parameters that they set, and some of them were a little bit unrealistic for a city as big as Quezon City, with a population as big as ours and a poverty rate as high as ours. No? So that was very challenging, and we actually did not sleep then, Ma'am Edna. We were working 24/7 just to make that deadline that was given to us, you know, and to make sure that everyone got their social amelioration funds on time, because we were so afraid that if we did not give it out during or by the deadline, baka the national government might take it back. And I didn't want the people to be deprived of what they should be receiving in terms of assistance. I think that was the biggest challenge. And then I think the biggest victory, of course, are the numbers, no? Like you can... I showed you, Ma'am Edna, I mean, everybody is expecting Quezon City would have the highest numbers. And yet we don't. We don't have the highest numbers. The cruise control line I showed you, that is very positive because our numbers are not going up. They're not going down yet, I admit, but they are not going up. And that's for me, a very big victory already, because now there's no way else to go but down, right? So I think that is something I'm very proud of.
A question from Vincent Barcelona. Would Class A municipality and city like your city assist other cities and municipalities who don't have the means for having online services?
I don't know in what way we can help. We've helped other municipalities in many ways already, because sometimes we get a lot of donations. We have many sister cities from other countries that have been donating to Quezon City, things like PPEs and some minor hospital equipment or necessities for our quarantine facilities, and we have been sharing these with other municipalities. But and then also there are a lot of stranded families still living here in Quezon City who have not managed to go home, and we are still helping to support them. And we also have a home for the homeless in Quezon Memorial Circle. It's like something that we kind of fabricated, but there's a lot of social distancing going on there as well. And these are families that live elsewhere who we are currently taking care of. So there's no rush for us to send them back. We just want to make sure everyone is okay during this period of crisis.
Let's give Mayor a little bit of a break. So I'll post question to Vanessa Tanco for now. The question to her is, can the app be available to remote areas or to those in the provinces? I think it has to do with connecting other places, but will the app be applicable to places like this? And the other related question is the app for free? How do you access the app?
Yes.
Vanessa?
Okay, so yes, the app is free. You can access it through Maze. Our website is maze-iacademy.ph. You can also access it through Google Play. So for Android phones, we are still currently working on the iOS version. It's completely free. It can be accessed in the remote regions also, and it requires very minimal data usage. So, yes.
But there has to be some data available.
Yes, there has to be some data available, but very minimal usage is necessary.
Right. I think, thank you, Vanessa. There are many more questions addressed to the mayor, such as what are the interventions or programs by the city in terms of psychological aspects of the constituents in facing the current situation? Mayor?
Well, maybe I just want to mention maybe two, just to give more time for the other people to ask questions to our speakers. But we have a crisis center for women and children that it's an old program of mine. It's had to stop during the ECQ, but now we have a shelter now because I realized that the number of domestic violence cases has increased drastically during the ECQ and the quarantine, because women and children were actually living in the same household with their perpetrators. And so we have that service available now, and that really will help because we have counselors there, we have legal assistants there, we have social workers there, and we have medical practitioners there as well to look after victims of violence of all kinds. And then with regards to psychological assistance to COVID patients, we have them as well. If you are confined in any of our facilities, our 3 quarantine facilities or our 3 hospitals, we have a resident psychiatrist or psychologist that will look after your needs, so that the trauma of having COVID-19 is something that you can also get over. In relation to that, I also want to say that Quezon City was one of the first cities next to Manila to have passed an anti-discrimination measure, and this is to protect our health workers as well as COVID-19 patients that are already well. I got a lot of reports of people already well, but were not allowed back into their condominiums or into their villages, and that's not acceptable to me, and that's why we had to pass this measure to protect them.
Thank you, Mayor. Mr. Conde, this is for you. What is the most important thing nowadays, human life or human rights?
Well, thank you for that, Ma'am Edna. No, I think this is related to a question that posted earlier that I would like to answer. One commenter said that human rights is skewed in favor of the violator. Now, I would like to point out that a public health crisis such as this one does not eliminate your human right and your right to dignity. While there is some leeway given to government to address issues such as this in an unusual way, like quarantining, locking down people, arresting people, those need to be done in accordance with human dignity and human rights. Now, I'm very glad that Mayor Belmonte disciplined that barangay personnel who manhandled the fish vendor in Quezon City a while back. Because really, even if this idea that masyadong maraming pasaway, and so dapat ikulong sila sa mga kulungan ng mga aso, dapat bugbugin. This idea is not consistent with human dignity and human rights. I'm surely there is a way to keep people from worsening the public health crisis without violating their rights. I don't see the point of, for instance, bugbugin or pagpapaluin yung isang tao just because he didn't wear a mask, or put them in a cell na halos hindi makakilos, samantalang meron tayong social distancing. Now, having said that, there are realities on the ground that need to be kept in mind, which one of them is that the local governments have limited capacity in terms of handling, for instance, detainees, because again, as I pointed out in my talk, they were not prepared for this. This is unprecedented. Parang lahat nangangapa. But that is not an excuse to violate the rights of people. So I have to, we are not favoring the violators of lockdown. Human rights is not favoring them. What we're saying is that you do not violate the dignity of people even further by committing these acts that are prohibited by international law that the Philippines has signed on to.
Sorry, I was muted. The question is for Vanessa. There's an observation from the audience, from the participants, that the Maze Eye Academy is not encrypted, not secure, and therefore it is not safe to use it. Can you comment on this, Vanessa?
It is encrypted and secured. So
all right, that's all right. That clarifies it. I think this is meant for the mayor again. How are we going to help senior citizens during pandemic, especially that they are not allowed to go out? They are, by the way, some senior citizens are saying, we didn't commit a crime. Why are we locked up? They are psychologically affected because there's no time for them to enjoy outside. Mayor?
Yeah, well, it's not that they are prohibited. They are discouraged from leaving, especially if they have comorbidities. And these are illnesses that will make their situation worse if they contract COVID-19. So it's for their own personal health and safety. But having said that, we have encouraged the barangays that they should have hours that are, let's say, senior citizen hours. I got this idea from another city actually, where senior citizens are allowed to go out and the rest of the population stay indoors muna, so they don't infect the seniors, and allow the seniors to do Zumba or to jog or walk around, enjoy their gardens. So there's something like that some barangays in Quezon City are doing. And in regards to their needs, we had a program that provided for senior citizens. It's called Kalingang QC. We gave financial assistance to all the senior citizens in Quezon City. And now we are developing a program to make sure also that all their medication is provided for them, including vitamins. And I'm now trying to do the math because doctors are telling me that if there is no vaccine available yet, it might help to give the pneumonia vaccine to our senior citizens, because at least they will not contract pneumonia if they get the COVID virus. So these are some of the things we're thinking about to do for our seniors.
Okay. Another question. I would like to ask if the database of Quezon City is updated. That's a question from our registrant, from our participant.
Well, Ma'am Edna, this COVID situation actually has a silver lining in that I inherited a database that was not actually updated. Everything was mano-mano on a logbook. And because of this, the need to provide financial assistance, the need to provide aid, the need to look after our seniors in a more special way than others because they are the more vulnerable sectors, allowed us to update and computerize our database. And so now, imagine that we were able to update everything, and it turns out we have, I think, 150 to 200,000 less senior citizens than what was originally in our files. And so this will also enable us to clean up our database to make sure that the spurious senior citizen cards that are still being used now to take advantage of the discounts can also be invalidated.
So in a way, this gives us the opportunity for improving and for leveling up the work.
I think so, yes.
That we do. Yeah. Another question. Would Quezon City be willing to take in residents who are coming back from their provinces?
Well, Ma'am Edna, I think now that the trend is for people to actually go back to the provinces. That's why I think Senator Bongo has a Balik Probinsya program, because really the cities have been very hard hit by the pandemic. A lot of businesses have closed down. A lot of people have lost their jobs. In fact, one thing that the city, our city is doing, which others have not yet started to do, is to have its own stimulus package where we're giving financial aid in terms of wage subsidies to businesses, just to prevent them from closing down and just to prevent more layoffs. No? So we have allocated 700 million pesos for that particular program. But much as we'd like everyone to come and work in Quezon City, as they have in the past, I think the opportunities might not be here at the moment. They might be better in the provinces.
Mm-hmm. Okay, I think a question for, there are lots of questions. I'm sorry, I cannot read all, but there is a question again for the mayor. What are the plans of Quezon City, or how is Quezon City taking the needs of students for blended learning?
Yeah, well, like I mentioned earlier, this is a policy of course, our national government, that there should not be any face-to-face classes until a vaccine is found. No? So having said that, here in the local government, what we wanted was to make sure that the students still receive as much of an education, or as good as an education that they can possibly get, given this absence of face-to-face interaction. When we did a survey of students in Quezon City, most students still believe, 74% actually believe, that they can only learn through face-to-face interaction. So that now raises a great challenge for us, no? Because that is not acceptable. That is not an option at the moment. So like I mentioned in my talk earlier, we've invested 2.9 billion pesos. This is the most we've ever invested in education. And this is to make sure that our children can at least have the gadgets that they need, and the printed modules that they will be needing, and all the other tools that they will be needing to make distance learning at least successful, given this situation that we're in, that we all don't want to be in anyway. But hopefully, we're trying our best to anticipate the problems as early as now, because the school year will not start until August 24. So as early as now, we're doing dry runs. We're trying to figure out how things will be delivered, how services will be delivered, how lectures will be delivered, how online classes will be conducted. So the kinks should be ironed out by August 24 when the school year begins. That's my hope.
Okay, I think there are many more questions posted in the Q&A board, but this is almost like time is up for us. But may I request each one of our expert speakers do a final, we'll go through a round of statement and message, key message that they'd like to say from each one of you. Shall we begin with Ms. Vanessa Tanco? Vanessa?
Okay. First of all, I want to thank you, Ms. Edna, and all the other experts here, Mayor Joy and Mr. Carlos, for a wonderful discussion. And I would like, I'm hoping that everyone will really practice physical distancing so that we can all be safe in our community. Thank you. Thank you for having me.
Thank you too, Vanessa. Carlos, Mr. Carlos Conde.
Yeah, thank you, Ma'am Edna, for this wonderful opportunity, and thank you to Ms. Tanco for participating, and of course, most especially to Mayor Joy for her insights and for the information. I would like to end by saying, by pleading to local government units to be more proactive in terms of making human rights and human dignity in addressing the COVID-19 pandemic a priority. I mean, I know and we realize that LGUs have a lot of problems on their hands that they deal with, but really, I think human rights, when you deal with a public health issue like this, is non-negotiable. There are ways to do it. One way is, for instance, for local governments to really instill in barangay enforcers that they cannot just violate people's rights just because they're pasaway or just because they think that they are pasaway. There are due process that needs to be followed. And as I said kanina, your human rights is not invalidated just because there's a public health issue. And I'm very happy that Quezon City, through Mayor Joy, is doing a lot of that. And I hope that other LGUs will emulate what Mayor Joy is doing in terms of making sure that the human rights of people are, especially yung mga marginalized, like the elderly and those with special needs, are met and supported. Thank you.
And finally, Mayor Joy.
Ma'am, well, I just want to thank you for the opportunity to address everybody who joined us today on this particular webinar. And thank you to Vanessa for her great app. I got the details of that, and to Mr. Conde. And I just want to assure Mr. Conde that in Quezon City, you can rest knowing that your local government is respectful of human rights. And we are doing everything that we can to make sure that this pandemic can be addressed without having to violate anybody's dignity and integrity. We've done it, not perfectly as you can see, but as best as we can. And to the general public, it's simple. The message is clear. The virus is still there. It hasn't gone anywhere. It's still with us. Hindi nagbabago yan. So the best way that we can combat this virus is just physical distance, wear your mask, wash your hands, and if you're feeling sick, stay home. If you're not feeling sick, but you have nothing to do anyway, stay home as well. That's all, ma'am.
Thank you very much to our wonderful battery of experts and speakers in today's webinar. Ms. Vanessa Tangco, Mr. Carlos Conde, our dear Mayor of Quezon City, Mayor Joy Belmonte. As we can see, human rights is like a thread woven into each and every function of our life. When we do social development assistance as local government unit, when we try to bring in new innovations and new technology into our lives, we are all striving to contribute to make human life significant, to be better, and to uphold the dignity of the human person. We're all working around how we can fight COVID-19, and the virus, as the good mayor said, is still there. Despite the fluctuation in the categorization of our the state of quarantine, it's still there. There is no vaccine yet. So we all take care. We thank to everyone. I'm sure everyone benefited so much from the sharing, from the rich experience. We are going through ups and downs, but hopefully we will continue and strive to be good contributors in our society against our fight, on the fight against the pandemic. So once more, on behalf of the UPC-FAL Philippines, our partner, iAcademy, the Ramon Aboitiz Foundation, and also the Inquirer.net, thank you once more to all who participated, to the good mayor of Quezon City. We hope to see you again, ma'am, sooner, later. Mr. Carlos Conde and Vanessa. Thank you to everyone who participated. We'll give you copies of the presentations and the recording, and we'll be in touch for the succeeding series of webinars on sustainable development goals. Thank you so much. Have a good day, everyone. Bye.
Thank you.